Hey guys, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today we're gonna talk about the Fleischner Society 2024 Glossary of Terms for Thoracic Imaging, Part 5. Let's begin. This topic is based on the radiology, reviews and commentary, statements and guidelines, Fleischner Society Glossary of Terms for Thoracic Imaging by Alexander A. Benkier et al. Radiology 2024, 310. This topic is for you who want to know the definition of and the radiographic CAT scan findings of the thoracic diseases. Oligemia, anatomy, physiology, pathology. Oligemia is a focal or diffuse reduction in blood flow and or blood volume. At imaging, pulmonary oligemia appears as a decrease in attenuation and or as a decrease in dimension and number of pulmonary vessels. Imaging signs of oligemia can be subtle and may require comparison with normally perfused lung for accurate detection. Opacity, anatomy, pathology, descriptor. Opacity refers to any focal or diffuse nonspecific area of increased attenuation. The term is a general descriptor that does not indicate the nature of the condition causing the opacity. The term has sometimes been used synonymously with the now obsolete and non-recommended term infiltrate. Organizing pneumonia pathology. Organizing pneumonia is a histologic, clinical, and radiographic entity reflecting a repair mechanism of the lung parenchyma after exogenous or endogenous injury. Histologically, organizing pneumonia is characterized by loose plugs of organizing connective tissue in distal airways and alveoli. The imaging presentation is variable, with sharply defined peripheral or bronchocentric consolidation with or without ground glass, air bronchograms, curvilinear perilobular opacities, nodular opacities, and atol sign being common manifestations. However, numerous additional manifestations and patterns have been described, including peripheral sparing. Organizing pneumonia pathology, atol sign. The arrows in the coronal and axial CAT scan images show the atol sign of organizing pneumonia. Organizing pneumonia pathology, peribronchovascular. Black arrows indicate the peribronchovascular of organizing pneumonia patient. Paratracheal stripe anatomy, right paratracheal stripe. The interface between the right tracheal wall, the adjacent pleura, and the mediastinal fat between them, as seen on frontal chest radiographs. It begins superiorly at the level of the clavicles and extends inferiorly to the right tracheobronchial angle at the level of the azygos arch. Left paratracheal stripe. The interface between left upper lobe and either the mediastinal fat adjacent to the left tracheal wall or the left tracheal wall itself. It extends superiorly from the aortic arch to join with the reflection from the left subclavian artery. Thickening of the stripe on either side may reflect enlarged lymph nodes, hematoma, or another mediastinal pathology. Paratracheal stripe anatomy, right and left paratracheal stripe and obliteration. Arrows on left chest radiograph show right and left normal paratracheal stripes, and arrows on right chest radiograph show obliteration of right paratracheal stripe and bulging of 4R lymph node in sarcoidosis patient. Parenchyma anatomy. Parenchyma refers to the part of the lung tissue involved in gas transfer. The lung parenchyma includes the alveoli, alveolar ducts, and respiratory bronchioles. Parenchymal band pathology. A parenchymal band is a thin linear opacity paralleling the pleura, occasionally described as extending to the pleural surface. It can be associated with architectural distortion and is commonly seen in the context of asbestos exposure. More recently, it has been described as a sequelae of COVID-19 pneumonia and organizing pneumonia. Parenchymal band pathology. Arrows indicate the parenchymal band in right lower lobe. Parenchymal band pathology. Arrows indicate the parenchymal band of another patient in right lower lobe. I appreciate your subscription and like. I hope you to be healthy, wealthy, and happy. Pattern anatomy pathology. Crazy paving. Focal areas of ground glass opacity with well-defined margins, within which septal thickening and intralobular reticular lines can be identified, in a pattern similar to crazy paving stonework. Interstitial, descriptor referring to underlying connective tissue framework of the lung. Biliary, subcategory of nodular pattern designating profuse, diffuse, and randomly distributed, well-defined micronodules of uniform size, with diameters of 1 to 2 mm resembling millet seeds. Pattern anatomy pathology. Crazy paving. Left lower lobe of this COVID pneumonia patient shows ground glass opacity of a crazy paving pattern. Pattern anatomy pathology. Miliary. Miliary nodules are shown on this left lung of the tuberculosis patient. Pattern anatomy pathology. Mosaic. Patchwork of regions with normal and abnormally increased attenuation. Mosaic attenuation. Nodular. Pattern including nodules. Reticular. Collection of intersecting linear opacities that produce an appearance resembling a net, sometimes referred to as reticulation. Reticulonodular. Combination of a reticular and a nodular pattern. Pattern anatomy pathology. Reticular. Yellow squares show the reticular pattern. Pattern anatomy pathology. Reticular. Yellow square shows the reticular pattern. Pattern anatomy pathology. Reticulonodular. Yellow square and arrows in the magnified image show the reticulonodular pattern. Pattern anatomy pathology. Reticulonodular. Arrows show the reticulonodular pattern in lymphangitic carcinomatosis patient. Pattern anatomy pathology. 3 attenuation, 3 density. Combination of sharply demarcated zones with normal increased and decreased attenuation on CT images acquired in inspiration. 3. In bud, micronodules connected to linear opacities with one or more branching sites, thus resembling a budding tree. Pattern, anatomy, pathology. 3. Attenuation. Arrows indicate normal, increased, and decreased attenuation. Pattern, anatomy, pathology. 3. In bud. Arrow indicates 3 in bud appearance in tuberculosis patient. Pleura, anatomy. The pleura is a two-layered serous membrane folding back on itself at hilum that covers both lungs. 2 layers of membrane are separated by a small amount of viscous lubricant called pleural fluid, which causes surface tension and, together with negative pressure, pulls parietal and visceral pleura adjacent to each other. Each pleural layer consists of a monolayer of mesothelial cells and a layer of underlying mesenchymal tissue. Both layers form the virtual pleural space. At imaging, normal pleura is best seen when it forms interlobar fissures or in the presence of extrapleural fat. See anatomic distribution. Pleural anatomy. Parietal pleura is pleural layer that lines the inner surfaces of thorax on each side of mediastinum and can be subdivided into mediastinal, diaphragmatic, costal. Visceral pleura is pleural layer that covers surface of each lung and inserts between lobes of the lung, forming interlobar fissures. The adjectival form pleural is often associated with the following terms: effusion, pathology, excessive pleural fluid caused by mechanical factors, edema, infection, inflammation, or malignancy. Pleura anatomy, visceral pleura. Each arrow indicates right upper lobe, middle lobe, and lower lobe visceral pleura in a pneumothorax patient. Pleural anatomy, pleural metastasis. Arrows indicate the pleural metastasis from lung cancer on left side. Pleural anatomy, pleural and fissural effusion. Black arrows indicate the pleural effusion on lateral side, and white arrows indicate fissural effusion in the right major fissure. Pleural anatomy. On radiographs, small pleural effusion manifests as blunting of the costophrenic angles, often meniscus-shaped, and larger effusions are homogeneous opacities in dependent regions. On CT exam, effusions are of variable attenuation and widen pleural space. CT can depict loculations as well as pleural thickening and hyperemia when performed with contrast enhancement. Plaque, pathology, fibrohyaline focal lesions arising in parietal pleura. Pleural plaques are usually associated with previous exposure to natural fibrous silicates, usually asbestos. At imaging, pleural plaques are well-defined, elevated, flat or plateau-like areas of pleural thickening that often contain calcifications. Pleural anatomy, pleural effusion. Arrows on left chest radiograph shows paraspinal line obliteration and meniscus sign of pleural effusion, and arrows on right film shows costophrenic angle obliteration of pleural effusion. Pleural thickening anatomy, pleural plaque. Arrows indicate pleural plaques, non-calcified and calcified from asbestos exposure. Pleural anatomy, tech, pathology, one or more coarse linear or band-like strands extending from a structure, for example a nodule or its components, and having direct contact with the pleura or a fissure. Pathologically, pleural tacks are often associated with thickened interlobular septa connecting a structure to the pleura. While usually nonspecific, pleural tacks have also been described as a potential indicator for visceral pleural invasion. Pleural anatomy tag. Arrows indicate pleural tacks from left upper lobe adenocarcinoma. Pleural anatomy, thickening, pathology, focal or diffuse increase in thickness of pleural, commonly caused by fibrosis following chronic or recurrent mechanical irritation, for example by rib fracture and by pleural effusion or pneumothorax. Pleural thickening can also be caused by asbestos exposure or infection, as well as by neoplasms such as metastasis, lymphoma, or mesothelioma. Pleural thickening is visible at CT as a soft tissue curvilinear stripe passing internally to ribs and innermost intercostal muscles. Thickened pleura often enhances and is best seen after IV contrast administration. Pleural thickening anatomy, metastasis. Arrows indicate the pleural metastasis. Pleural thickening anatomy, split pleural sign. Arrows indicate visceral and parietal pleural thickening in a chronic tuberculous empyema patient. Pleural thickening anatomy, split pleural sign. Arrows indicate thickened and enhancing parietal and visceral pleura, split pleural sign of empyema. Pleural thickening anatomy, visceral pleural involvement. Arrow indicates pleural involvement due to adenocarcinoma of ground glass opacity. Pleural thickening anatomy, visceral pleural involvement. Arrow indicates pleural involvement, visceral pleural involvement by adenocarcinoma of ground glass nodule. Pleural thickening anatomy, pleural-based. Arrow indicates pleural-based nodule from rib metastasis. Pleural thickening anatomy, pleural calcification. Arrow indicates a pleural calcification, pleural lesion from previous tuberculous pleurisy. You quit smoking? Your great job of the year. Congratulations! This is the last slide. You worked hard. You worked very, very hard today. See you soon on part 6. Goodbye.